Did you know that as of 2012, 117 million people had one or more chronic health conditions? 4 health indicators that are prominent in health issues are immunization, physical activity and obesity, substance abuse, and tobacco use.
There are 6 vaccines recommended for all children to have prior to 6 years old. They are Hep B, rotavirus, DTaP, Hib, PCV, IPV for polio, influenza, MMR for measles, mumps, and rubella, varicella for chickenpox, and Hep A. Vaccinations are a primary approach to prevention. They help to reduce the spread of disease by preventing the possible contraction of it. They are cost-effective, and most places, both nationally and globally, have some sort of access to at least the basic vaccines needed for health. Don't wait. Vaccinate.
The World Health Organization and the U.S. Department of Health and Human Services recommends that adults get the equivalent of 2.5 hours of moderate to vigorous physical activity each day. Globally, about 1 in 3 people do not get enough physical activity each day. More than 1/3, or 78.6 million of U.S. adults are obese. Obesity-related conditions include heart disease, stroke, type 2 diabetes, and certain types of cancers, some of the leading causes of preventable death.
Substances include alcohol, cocaine, bath salts, inhalants, and marijuana. Substance abuse can result in strong addiction, health risks, and chronic diseases, as well as poor judgment and cognitive skills. It can also result in death. Don't do drugs. Abusers should seek treatment as soon as possible. They should begin withdrawals from substances. Abusers should also detox their bodies with cleanses. They should also take medication prescribed from a doctor. Abusers should also enter rehab centers, and they should seek counseling.
$8.6 million people die each year due to illnesses caused by smoking. Smoking can potentially increase risks for coronary heart disease by 2 to 4 times, stroke by 2 to 4 times, lung cancer in males by 25 times, and lung cancer in females by 25.7 times. More than 33,000 non-smokers are at risk for COPD due to secondhand smoke. There is no safe level of secondhand smoke. Since 1964, approximately 2,500,000 smokers have died from health problems caused by secondhand smoke exposure.
All of these health indicators are extremely vital to consider in order to improve health conditions or prevent further illnesses. Participating in physical activity, taking the initiative to keep up to date with vaccinations, and refusing to intake harmful substances and tobacco are some of the ways that people can improve overall health. As a holistic view, we can agree that education is a key element that serves as a foundation to build a better lifestyle. This channels awareness and advocacy. Each choice reflects our behavior and impacts the consequences of our decisions being made every day. These are some of the leading factors of health that should be taken into consideration to enhance health conditions.